This is Dr. Mohamed. I am professor of diagnostic and interventional radiology in Ain Shams University, Cairo, Egypt.
Did you present any sessions or workshops at this year's Pairs Congress?
Yes, I presented many presentations, and I participated also in one of the workshops. My presentations was about doing the TIPS technique by DIPS in cases of Budd-Chiari syndrome with portal hypertension. This is one of the presentations. Another presentation about joint embolization of knee osteoarthritis in one of the workshops. And I also did a presentation about prostatic artery embolization for benign prostatic hyperplasia and how to detect the penile related anastomosis and how to avoid and manage the complications related to this procedure.
All right, so for you, the prostate artery embolizations, how often do you complete those procedures in your own practice?
Actually, I do it a lot. It is one of my preferred procedures, and I have a lot of patients, so I do it weekly. I have many cases weekly of prostatic artery embolization, actually.
The prostate artery embolization topic that you presented on, what key points would you like to highlight to the audience?
Well, I focused on how to avoid the possible complications related to the penile anastomosis in my presentation this year, and this is very important because most of those patients are willing to maintain their sexual potency, and this is an advantage in prostatic artery embolization over other surgical techniques because it is safe regarding this issue and it does not cause any erectile dysfunction or retrograde ejaculation. And so I focused on how to do this technique safely and how to avoid non-target embolization to avoid related complications. And if complications occurred, and they are actually minimally because it's very safe technique, how to deal with these complications. And actually these complications, if occurred, they are in the form of some ischemic changes at the glands of the penis, and they are usually mild and temporary complications without any long-term sequelae and without any effect on the erectile function.
Can you give any guidance to younger interventional radiologists who are just now starting out in their practice or even getting into the prostate artery embolization procedures?
Sure, yes. We always focus on being safe, especially for the younger generation or the beginners of the technique. Always try to avoid the complications, especially in the beginning of your practice or in the beginning of your learning curve, by knowing well the related anatomy and the related anastomosis, how to detect them and how to avoid them.
How long have you been attending the Pairs Congress?
Maybe 14 years now. Yeah.
Okay, so
every year I come. Yeah.
Over those years, what changes can you talk about that you have seen?
Actually, the Pairs now is getting bigger and bigger every year, and we are proud of this. Actually, it is now one of the biggest IR meetings all over the world, and every year we get more presentations about new techniques and get exchange of experience with the experts all over the world.
Is there anything that you would like to see for the future conferences?
Yes, I think maybe we need to do more live cases. This is very interesting for the audience and give tips and tricks about the techniques. I think it will be very beneficial if we increase live cases.
All right, so to wrap this up, is there anything that you would want to highlight to anyone attending or thinking about attending the Congress?
Yes, I encourage every IR, especially the beginners, to try to attend the Pairs. You will get much benefit from the scientific content of the presentations and from exchanging experience with experts from all over the world. And I encourage them to present their work in the Pairs.